Okay, so good evening, everyone. We are all set for the live broadcast stream of today's Health and Human Service Committee meeting at 6 p.m. on HPA-TV Comcast and Frontier Government, channels 96 and 6032. It would also be streamed via hpa-tv.org, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It'll also be rebroadcast and made available on HPA-TV YouTube channel. So today we have voting member Councilwoman Marilyn Rossetti. We have Director Liani Arroyo, Director of Health and Human Service. We have Dr. Mark Mitchell, and then we also have Alex Rodriguez from Save the Sound. So we'll go over the agenda as it appears here, and the first, so we'll call this meeting to order. So the first agenda item was introduced by Council President Rosado, Majority Leader Clark, Councilman Gale, Councilman Sanchez, and Councilwoman Rossetti. And it's a resolution that to reinvigorate our economy and improve our city's public health, the Court of Common Council urges the Hartford delegation and the entire state legislature to pass the necessary legislation to implement TCIP in Connecticut. So with that being said, Alex and Dr. Mitchell, the floor is yours. I'm not sure who's going to go first.
I will go first. So I am Dr. Mark Mitchell. I was previously in the Director Arroyo's position. I was previously the director of the Hartford Health Department in the 1990s, I'm sorry. And I also am now with the university. Actually, I work, even though I live in Hartford, I work full-time for the George Mason University in Virginia, where I am an associate professor of climate change, energy, and environmental health equity. So I wanted to talk a little bit about TCI, the Transportation Climate Initiative. The Transportation Climate Initiative is a proposed piece of legislation for the state legislature. And what it will do is to put a charge on gasoline and diesel and use in order to reduce the pollution from transportation. And so they will reduce the amount of pollution by 26% over 10 years. And from transportation sources, from gasoline and diesel fuel. Now, in Connecticut, 2/3 of all pollution is from transportation. And so this is particularly a problem in our urban centers. Me, for example, I live here on Maple Avenue in Hartford, and there's a lot of traffic on Maple Avenue, even though 50% of the households, almost 50% of the households in my neighborhood don't have automobiles. We have a lot of traffic from people working in Hartford and passing through Hartford. I'm, for example, the first person in my family to have asthma. And I also, and I attributed that to the traffic-related air pollution, as well as some of the toxics that we have in our air, like from our trash incinerator. But traffic-related air pollution is not only associated with respiratory conditions, it's also associated with cardiac conditions, with coronary artery disease. I had started my exercise program of walking in Hartford. And one day I was walking past Hartford Hospital, and I started feeling a tightness in my chest. And I said, uh-oh. So I stopped and it went away. And then I was fine the rest of the day. Then the next day I was walking again, and at exactly the same place on Jefferson Street in front of Hartford Hospital, I felt the same tightness in my chest. So I knew, as a physician, I knew what that was likely to be. So I went and saw my doctor, and it turned out that I had coronary artery disease and angina, and which is which can lead to a heart attack if it's not taken care of. So I had 4 vessel disease, and I had an angioplasty, and it took me about 3 to 6 months to fully recover from that. And again, nobody else in my family has ever had that type of heart disease. So I've been very concerned about the links between asthma, allergy, and heart disease. But also, people ask me, why do we have such high rates of uh, of ADHD, of hyperactivity disorder in our schools? We know that that's also related to traffic-related air pollution. Autism, we know, is related. Why is it more common in children of color? We know that it's related to traffic-related air pollution. Even preterm delivery, premature delivery has been shown to be there. So TCI is the first bit of legislation that I'm aware of that I believe will, in fact, make a difference in reducing asthma in Hartford. And the way that it's being structured is focusing on environmental justice. It's focusing on health equity. Every year they expect to raise about $100 million, between 90 and 110 million dollars. And half of that has to go to communities that are overburdened by air pollution and underserved by transportation. So I think that there's a significant amount of investment that can go to Hartford, as well as other urban areas. And so that's why we are asking the city council to pass a resolution so that our state representatives will support TCI. So, what can we do with the funding from TCI? And I think I'll turn it over to Alex to talk a little bit more about what's possible.
Thank you, Dr. Mitchell. Thank you for sharing your story. This was the first I've learned about, the intense struggle that you've experienced. Like you, I also struggle with a respiratory problem. I have asthma, and being exposed to high vehicle exhaust for prolonged periods of time does exhaust me. I want to talk a little bit about climate change before I nail the investments piece. To just reiterate a major point that you made, the Transportation and Climate Initiative program would support Connecticut with a 26% reduction in greenhouse gas emissions within 10 years. TCI is needed to help Connecticut meet a state mandate of 45% greenhouse gas reduction by 2030 and 80% by 2050 in accordance with the Global Warming Solutions Act. The Global Warming Solutions Act was the first major piece of climate change legislation to be supported in Connecticut and passed. Something that I want to mention about the Transportation Climate Initiative program is that we would not be alone in pushing this program, this cap on transportation emissions and a reinvestment in the transportation system. Massachusetts, Rhode Island, and Washington, D.C. have all agreed to implement this program, but they're waiting on Connecticut. And this program could not come at a more crucial time because Connecticut is not on track to meet greenhouse gas reduction goals. On the investments piece, Transportation and Climate Initiative program, the revenue generated from it, the $89 million generated a year throughout 2033 is meant to be invested in pollution reduction technologies. This could go towards the infrastructure needed to support better walkability and bikeability in our city. This could go towards the electrification of school buses. As many of you may be aware, children are the most vulnerable to respiratory illness because many children rely on school buses to get to and from school, and 95% of the nation's fleet is primarily run off of diesel power, which emits high particulate matter and thereby affects their ability to breathe. And it also impacts the neighboring community's ability to breathe. Another thing the TCI program could go towards is a more affordable, accessible, and reliable transit system. I think CT Transit has done, and the DOT have done great with the current system in Hartford. However, there's always room for improvement. There are many people that get out of work at 12 o'clock at night or 1 o'clock in the morning that would benefit from access to a bus to be able to get home, and that could be done through the TCI program. Expanded internet broadband is another investment that can be made possible through the TCI program. It's covered it's covered as a potential line item because many people rely on the internet when they're taking transit bus or they're taking the CT rail to get to where they need to go. And then the other investment I have mentioned here is EV charging stations. There is a state mandate in place to install about 300 charging stations in the state of Connecticut in 2030, and Connecticut is making steady steps to meet those targets. However, we need the infrastructure, we need the investment in our infrastructure to get there. And so we encourage the Hartford City, we encourage you all, the Health and Human Services Committee, to pass this resolution as it signals to the state that Hartford supports TCI because it is an investment in our health, it is an investment in our economy, and it is an investment in our future. And I think that now I will open it up to the council, to the Councilman OBrien and Councilwoman Rossetti for any questions that you may have.
Thank you, Alex and Dr. Mitchell, for the presentation. Before we go to questions, I want to introduce Councilman Gale, who is also a committee member, and Corporation Counsel Damar Osborne. So with that being said, I open up the floor to my colleagues. Any questions?
I have more of a statement, if you may. Councilman LeBron, hold on a minute. Someone's ringing my.
So while Councilman Gale, do you have any questions?
I also do not have any questions, and my apologies for joining late. But I am a co-sponsor of this, and so I feel it's a very important resolution. It's a very important policy. It's something that I'm pleased to see we had so many co-sponsors on it. It's always particularly useful when Hartford is a leader in these types of things. So I hope that our co-sponsorship means that council will be unanimous in adopting this policy so that we can make that statement. You know, these are serious societal issues that we're facing. And you know, I've been watching some of the dialogue that's been going on in the newspaper, the Hartford Current. There's been some back and forth letters to the editor. And frankly, you know, unfortunately, there's a lot of people out there who just don't get this stuff. They, you know, their analysis is, oh, it's another tax. These are societal issues that we have to tackle, and we have to begin tackling them in a serious manner. And so, anyway, I'm throwing my full support behind it. Thank you.
Councilman Rossetti, are you?
Yeah, sorry, I had
no problem.
First of all, as another sponsor of it, but also first of all, I wanted to thank you for the presentation. I thought it was well laid out and easy to understand. And I know people listening appreciate that. And it, you know, on another note, you know, with my day job, certainly Alex, your representation for access to transportation at off times, you're coming at it from one way, but boy, is that needed all around for people who have difficulty getting places. So I maybe enjoy is not the right word, but I'm happy to see something that can, you know, serve dual purposes, meet one end and also something else. So thank you for presenting that.
Thank you,
Thank you
Councilwoman.
both. So I do have a couple questions. So the first is, and whoever can answer it. So in terms of in terms of oversight and accountability, how does the state plan on doing that in some fashion in terms of where the money is going to be going to?
If I can answer that. So the money is part of the transportation fund. So it's in sort of a lockbox. And so it has to be used to reduce greenhouse gases and for improvement of transportation. And it will be advised, the equity and environmental justice, the 50%, you know, $450 to $500 million a year will be advised by an equity and environmental justice advisory board composed primarily of people who live in these communities that, like Hartford, that are overburdened by air pollution and underserved. But you know, they're advisory to the DEEP commissioner and to the Department of Transportation commissioner. But they will, and our discussions so far have focused on, you know, reducing air pollution and improving the transportation and you know, converting the school buses so that I don't know if you know it, but there's more diesel inside the school bus than there is outside. So the children are being exposed to more diesel inside the school bus. And so if it's electrified, there's no diesel to be exposed to. So so those are the things that we believe will be the major areas of focus. And the Equity and Environmental Justice Advisory Board, even though they don't have the final say, they will report directly to the legislature. So if things aren't going well, it will be public, and the legislature can do something about it. And so those are some of the checks and balances that are in place.
Thank you, Doctor. Just a follow-up question. Alex, thank you for that presentation. And, you gave a variety of opportunities for the state to kind of focus on. How do you imagine, and maybe this is kind of in the future, and maybe it requires a bit of foreshadowing, but, how would you both imagine that the prioritization, right, in terms of operationalizing or manifesting these actual dollars? There's so many environmental issues, right? And so how does that get weighed? Is data going to be involved? Are the community going to be involved? Or is it just kind of the advisory board to develop the process? I mean, are there other task force nationally? I know there's a lot of questions, but just to give us some guidance on how these dollars will plan on being spent, as you guys see it.
So the original plan was that we would pass this legislation at the state level by the end of the year, and there's still an opportunity that can happen. Where if this program were to pass at the end of the year, the program would be fully put into place in 2023, which would give Connecticut about a year to put into place the nominating committee that we've been advocating for, and the Equity and Environmental Justice Advisory Board to really put all the members comprised of rural representatives, urban representatives, and suburban representatives, put them all into place and begin a series of meetings with the commissioner and the deputy and commissioner of DEEP and the commissioner of DOT to identify transportation needs. A survey is likely to be thrown in the mix. However, I do anticipate that there would be some heavy input sought out from communities overburdened by transportation pollution and underserved by the transportation system. Dr. Mitchell, do you want to add on?
Yes, if I may. One of the major concerns was making sure that we're reducing pollution. First of all, that we're providing the benefits to the communities that are most impacted by pollution. So the idea was to actually put in a lot more air pollution monitors, particularly in the urban areas, so that we know where the pollution is and that we can document pollution reduction, preferably pollution reduction in those areas. And one of the reasons that we wanted to have community groups to nominate the people on the board was so that they have a community focus and that they bring back to those community groups, they report back to those community groups about what's happening and get their input, get the input from from the people in the community on what the priorities are, what the priorities should be for this group.
So thank you for that. I think I speak for myself, and I think my council colleagues is always having community voice at the table. I think it's important. I would take it a step further to see if not just the community, groups, if we could actually have them sitting at this advisory board to give that, community perspective. I realize you probably, there's probably a whole bunch of officials that we can nominate, but, the community voice and particularly a parent that could, give their own testimony, because the biggest thing about testimony is those that were tested. And so sometimes they have a unique point of view. So with that being said, I'll stop there, and seeing no questions, I'll take a motion from the floor. Councilman Gale, I think you're on mute.
Let's try it again. I move
Okay.
to send this back to council with a favorable recommendation.
Second it.
All right, seeing we have a motion on the floor that was seconded. Any discussion? Seeing none, all in favor, vote aye.
Aye.
Aye. Any nays? Any abstentions? Seeing none, the resolution is passed favorably. Thank you, Dr. Mitchell and Alex, for your continued efforts in your work. I know it doesn't stop here, and you know, there's a long journey in front, but thank you guys for taking the lead on this and protecting and protecting our community from this pollution and these environmental issues in Hartford.
So thank you, Chair LeBron, and the members of the committee. We certainly appreciate it.
Thank you.
Thank you, Councilman LeBron. Thank you, honorable members of the committee.
Thank you.
Okay. All right. With that being said, you guys can hop off, or you can hang out with us. It's up to you. I assume they'll probably hop off. All right. So next, Director Royer, we have a jam-packed agenda. It's that time of year for these particular resolutions. I remember them last year, so I can't believe it's been a year. But Director, how would you prefer we do it? You kind of want to discuss them all at one time? Do you want to discuss them one at a time? What would you prefer?
Happy to do them all at once, since they all sort of are primarily, at least the first group are around our elderly services.
Sure.
So I'll sort of talk about them as a group, and then
Okay.
do, you know, some details as to what
Sure.
we'll cover.
So all the way through 2.1. I just want to read them off for the public. So 2.1 to 2.5, and then we'll separate and do 2.6, 2.7 together. Does that
I
sound
could
good?
do 2.6 and 2.7 separately.
Separate. All right, fantastic. So let me read them off. Agenda item 2.2 with accompanying resolution authorizing the city to apply for and accept an operating assistance grant in the amount of $134,500 from the Connecticut Department of Transportation for operation of the city's Dollar Ride program. This was item number 3.3 on the September 27th agenda. Item number 2.3 with the company resolution authorizing the mayor of the city of Hartford to apply for and accept $95,000 in grants from the NCAA for the funding period October 1st, 2021 through September 30th, 2022 to be used for the Dollar Ride program. And that was item 3.4 on the September 27th agenda. Item number 2.4 with the company resolution authorizing the mayor of the city of Hartford to apply for and accept $60,000 in grants from the NCAA for the funding period from October 1st, 2021 through September 30th, 2022 to be used for the Heart and Home Health Program. Item number 3.5 on September 27th agenda. And Mayor Bronin with the accompanying resolution item number 2.5, Mayor Bronin with the accompanying resolution authorizing the mayor of the city of Hartford to apply for and accept $35,000 in grants from the NCAA for the funding period October 1st, 2021 through September 30th, 2022 to be used for the Kickball Living program. Item number 3.6 on the September 27th agenda. The floor is yours, Director.
Great. So these grants are all grants that we applied for. Are primarily being provided through our senior centers, and so but they're not only open to individuals in our senior centers, but that's where we get a lot of our referrals from. It's from our 4 senior centers. So I'll go through each of them very quickly for you all to understand what they're for. So the first 2 that you noted, I have it as, I think, 2.2, 2.3. You said 3.2, 3.3. Those are both for our Dollar Ride program. Our Dollar Ride program is a program that connects our seniors in the city of Hartford to our senior centers, to access to medical care and access to healthy foods by providing transportation to our local supermarket as well as supermarkets outside of the city of Hartford. So those two programs form a basis of a significantly larger program that we have, that the remaining amount of that is funded by city general fund dollars. That program has been in existence for many years, and we've pretty much kept level funded there for a period, for the last periods of last years that I've been here, and it has been able to operate at scale, providing numerous rides. I don't have all the data in front of me right now, unfortunately, but it does provide service 5 days a week for a period of 6 hours a day, which is significantly more than some of our surrounding areas in other large towns. So those two are funding for that program. And again, it's for funding for rides to our senior centers, rides to medical appointments, and rides to the grocery store, so that our seniors are connected to social activities, connected to medical care, and connected to be able to access healthy foods and large supermarkets. The next grant is the grant for the Heart and Home Health Program. We call it the Home Health Program. The Home Health Program is a program that provides short-term, limited, in-home home help assistance. So individuals who may be in need of services to assist them in their activities of daily living for a short period of time. It can be anywhere from 30 to 90 days. With the funding that we receive, the city matches that as well. And we work with the Hartford Healthcare at Home program to be able to serve anywhere, I think it's about 70 to 75 seniors a year with that. And so these are individuals whose insurance, if they don't qualify for additional services, this provides them those services while they need them to recuperate at home. So it can be like cleaning, like cooking, housekeeping, those types of services are provided through this program. And we receive referrals from our senior centers, and we also receive referrals from both hospitals. Both St. Francis and Hartford Healthcare will refer to us if they have clients who may not have other options or other insurance that can help pay for those services. So that program, again, we match. I believe we put in $50,000 to $55,000 from general funds to make that a larger program to be able to serve seniors here in the city of Hartford. The next resolution for the Keep on Living program, the $35,000, that funds services at our North End Senior Center. It is a small program that does provides assistance for nursing, some money for a nurse to check meds, have conversations with seniors, do blood pressure checks, glucose checks. So it's a small program there that to provide some continuity and at least be able to identify what's happening earlier and assist our seniors in accessing medical care or any other care that they might need in order to be able to live a healthier life. So the majority of those, with the exception of the first one, which is through the Department of Transportation, the remaining of those are through NCAA. So the Department of Transportation is funded from the state of Connecticut. The remaining ones that I discussed is funding from the NCAA, which is our North Central Area Agency on Aging, and that is federal pass-through dollars. So that's funding that we receive through them. So the amounts aren't very large, but they help keep some services, and the city does match some of that funding as well to be able to amplify those services in the community. So I'll stop there and see if there's any questions about any of those.
Thank you, Director, for that. Any questions? No questions. Councilman Gale, any questions?
Yes, thank you. And my apologies for turning off my video. My iPad just told me that I'm running low. So it suggested that I turn my video off to make it through the end of the meeting. Director Rowe, you may have mentioned this, but I just wanted to confirm. All of these different amounts were built into our budget. Initially, we rather anticipated that we were going to get these grants. Am I correct in that?
Yes. I mean, there's always a possibility that we may not. And grants are, we have to recompete every year. Generally speaking, we have received these amounts for many years and have had some cuts in earlier years, but these have remained pretty stable since I've been here.
And so when you say pretty stable, are we pretty much getting what we thought we were going to get?
Yes.
Okay, thank you.
Director Arroyo, just in terms of how did we do through the pandemic with the, particularly the traveling with the seniors, and then, God willing, hopefully we don't have to go through that with this Delta variant, but how would that work in terms of safety for the seniors and transportation?
So, and any sort of form of public transportation, masks are required. So that is what was happening. Our previous provider, we just rebid and just started with a new provider on Friday, but our previous provider was sanitizing, ensuring that individuals had their bus on, and was following the protocols that the Department of Transportation had issued at the start of the pandemic. And at this point, we've not had any cases that we can trace to a DATCO bus. We recently restarted services to our senior centers on July 1st, and that has been going well. We had not been providing services to the senior centers since we closed in March 13th of 2020. That was our last day at the senior centers. We reopened for July 1st of 2021, and so far travel to and from the senior centers has picked up. We're ensuring that seniors have their mask on, and like I've said, we're also ensuring that everyone's vaccinated that is attending a senior center. We felt that was critically important, and we've worked with our senior centers to ensure that that is the case. So we know that individuals, at least traveling to our senior centers, are vaccinated. In terms of the traveling to and from doctor's appointments and shopping centers, not everyone has to be vaccinated to participate, but we do also know that our 65 plus population is over 99% of them have at least one dose, and over 90% of them are fully vaccinated. So we're feel fairly confident that the vast and overwhelming majority of individuals riding these buses are at least have one dose or are fully vaccinated. And we continue to ensure that we have access for those populations. And we are in the process of offering third doses to those that are immunocompromised, and boosters to individuals who were vaccinated with Pfizer in these populations as well.
Thank you, Director. Just one last question. Councilwoman Rossetti.
When you're done, Councilman LeBron, that's okay.
Yeah, so the question I have is, in terms of the staff at these senior centers, is there a requirement that they be vaccinated as well?
So it is my understanding that all of the agencies have done that, but I will confirm that that is actually the case. But that was the understanding that we had at the start of the pandemic, that everyone would have started their series prior to the opening of the senior centers. So I will confirm, but we do know that everyone entering, all of our seniors entering, are required to be fully vaccinated at this time.
Thank you, Director. Councilwoman Rossetti.
Thank you. Director Arroyo, that was what I was going to ask. It is very heartening, is that the word? Because disheartening is the other word. Heartening to hear that 90% of the seniors are vaccinated. That really, makes me feel positive, and I really applaud your department again for, working to initiate, coordinate, and get those vaccines out to the communities that particularly who need them most. So thank you very much.
Thank you.
If somebody wanted a vaccine now, I know you can almost get them anywhere. Where would someone go?
So any pharmacy that offers vaccines, you can look online for that, or most of them that I've seen driving through the neighborhoods have signage up saying that they offer COVID-19 vaccines. They are taking both walk-ups and appointments through that process. So if you want to do a walk-up vaccine appointment at a pharmacy, just make sure that the pharmacy in your area is actually offering it. You can call them and ask which one they're offering as well, and they should be able to tell you that. Our hospitals continue to offer vaccinations as well. So you can call 211, and that'll give you everyone, but just specifically to the city of Hartford, our hospitals continue to provide vaccinations as well, as do our federally qualified community health centers, and our lookalike here in the city are also doing that. Most are on a either walk-in basis, or they'll have walk-in hours and then by appointment through their providers on site. The city health department continues to offer a Thursday clinic from 2 to 6 we feel that offering a clinic that goes a little bit into the early evening hours is something that's needed. And so we continue to see that. And we'll see anywhere from as little as 15 individuals to as many as 45 recently. So we continue to see people coming through. And then at any given point in time, there are multiple mobile clinics happening around the city. So anywhere from 2 to 5 mobile clinics a week are happening in the city, either through our federally qualified community health partners, through our hospital partners, or as well through the Griffin Health vehicles that are contracted through with the state. And then we're also doing mobile vaccination clinics from time to time as well.
Thank you, Director.
Thank you, Director. Any other question or comments from my colleague? All right. This question is for Corporation Counsel. Mr. Osborne, are we able to kind of just can we approve all 1, 2, 3, 4 of these at once? Or do we have to do them individually?
To the extent that there's no objections to any of them, we could approach it similar to a consent calendar,
Okay.
and just approve them to the extent that there's no objections to any of them.
Okay. So if someone would like to make a motion to approve items number 2.2 through number 2.5 on the Health and Human Service agenda.
So move.
Any seconds? Favorably, yes.
Yeah, and I'll
All
second that favorable.
All right, any discussion? Seeing none, all voting in favor say aye.
Aye.
Aye. No opposed. So move. 2.2 through 2.5, let the record show that it was approved favorably. All right, Director. So on to the second piece, which is item number 2.6 on the agenda with the company resolution authorizing the mayor of the city of Hartford to apply for and accept $275,000, $523.64. Just a lot of money. I'm not used to saying that much amount of money. Grant funding from the Connecticut Department of Public Health. Item number 3.7 on the September 27th agenda. And item number 2.7 with accompanying resolution authorizing the mayor of the city of Hartford to apply for and accept $987,290 in grant funding from the Connecticut Department of Public Health. And that was on item number 3.8 on the September 27th agenda. The floor is yours, Director.
Sure. So 2.6 is funding that comes in yearly. It is a significantly larger amount. We were fortunate enough this year to have our state legislators from across the state advocate for local health and the role that they had played during the pandemic. And so with the increased funding that was coming in to the state, they were able to secure an additional per capita amount for our per capita grant. And so this grant is based on the number of individuals from the last, I think it was the 2019 American Community Survey, if I'm correct. So I suspect that the number will go down because it would now be based on the 2020 census next year. But this funding is an increase from what we received in the past. And so what we have done with this funding is similar to what we have done in previous years. We fund a position that we're required to have to do some work statutorily through the state of Connecticut, which is lead work. So we have a lead position that is working with and reaching out to children who are considered lead poisoned or have been lead exposed. And so we receive that information from the state. And so we have someone doing that. We have funding there as well to support pieces of other positions within the institution, particularly through the Wright program. And I'll talk about that sort of the next one that's coming after that. But the Wright program from the federal side, we have been a grantee from them for many, many years. But as we do well in terms of continuing to lower the number of individuals that test positive for HIV in the city, that funding goes down and we're limited statutorily by the federal government how much of that funding we can use to run the program. So there's a gap between what is needed to actually run the program effectively and the funding that we're allowed to use for that from the federal government. And so we're funding portions of some of those positions. These individuals also provide services to the city and to other individuals and other divisions within the department. So helping with data, helping with grant writing and other things. So it's funding some of those. And then we also use some of that funding to provide small mini grants to organizations. So we regularly provide um, funding for the North End Senior Farmers Market, the farmers market that takes place at the North End Senior Center. So we have provided the Hartford Food Systems some funding for that, and then we have sort of additional funding for organizations that may come to us. So for World AIDS Day, we've done the West Indian Festival in the past, so we have funding for that. And then the other thing that we use that funding for is to be able to pay for our mosquito program. So as you know, we had someone test positive this year for West Nile. It was the first time in many years that this had happened, but we have had a very robust and active mosquito program, mosquito prevention program here in the city, where we treat all of the catch basins throughout the city twice to prevent mosquitoes from being from eggs, any eggs that are being laid from actually becoming mosquitoes. And so we've done that already this year. That's already ended for the season. Mosquitoes are still around until the first frost, so you still need to be careful. But that is funding, and the city matches that with an additional funding as well. So we're able to do that with this funding.
Thank you, Director, for that. Any questions? All right, seeing no questions, I'll take a motion to approve item number 2.6 and 2.7 on the agenda.
So moved, sending it back.
Or him. Go ahead.
So I see a motion and second it. Any discussion? All in favor, say aye.
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 All right, and no nays. So with that being said, please note that item 2.6 and 2.7 was approved favorably to go back to the council meeting. So Director, thank you for all your presentations. I appreciate it.
We have one more.
Oh, we do?
Yes, the last one, the $987,000.
Oh, okay.
It was so much Nick couldn't understand it. He just went over it.
It's close to $1 million, all right, let me read it again. Okay, so 2.7, the accompanying resolution authorizing the mayor of the city of Hartford to apply for and accept $987,290 in grant funding from the Connecticut Department of Health, the Wright Part B resolution.
So we receive funding from the federal government for Wright program. So the city is the grantee for what is called the transitional area grant area, or TGA, transitional grant area, sorry. And so that includes Hartford County, Middlesex County, and Tolland County. So we're the grantee that provides funding to providers in those areas to assist individuals who are HIV positive or living with AIDS in order to ensure that they're accessing services if they do not have insurance, or if there's a gap between what insurance covers and what the needs that they have. And so the state of Connecticut is also a grantee, and this year they've decided to ask to provide, rather than provide funding to numerous organizations within our TGA, they've decided that they want to fund one organization to then fund the other organizations throughout the region. And as a result of that, our city is applying for the Hartford, Tolland, and Middlesex County area, which is the area we already cover, to continue to provide the additional money from the state to organizations within these three county area to continue to enhance the services that individuals with HIV or that are living with AIDS in our area. So we are applying. We have partnerships with of our 13 grantees already through our city funding. We have, I'm sorry, the state has funded, I'm saying 9 of the 13 that we fund are also funded by the state. So there will be continuity of services there. We already know the program, and so we decided to apply. And so that is what this one is for.
Any questions from my colleagues?
Yes, Mr. Chair.
Oh, yeah, Councilman Gill.
So, Director Wright, and kind of picking up on the last one, it sounded like on the prior resolution, that was actually a bit of an increase in funding from what you had budgeted. With respect to this particular resolution, is this also money that we basically had budgeted and we're expecting, and thankfully it's coming in just pretty much as expected?
Completely new grant. So this would be an additional $1 million.
So this is expanding services that you have in your budget already to take on some more responsibility.
Well, the state has been providing this funding to many organizations in the grant area that we already provide, that we are also providing funding. So it wouldn't necessarily increase our services, but will allow some continuity and some efficiencies in those services. So the state receives this funding directly from the feds. They are a grantee of the federal government for the Ryan White program. We are also, as a city, a grantee from the federal government directly. The state decided to take a different tactic. Rather than funding all these multiple organizations, they want to fund just several, a handful throughout the state. And so it's a little different. It will essentially be keeping the funding that's already coming to these organizations to continue to come in, but we will be the fiscal agent, if that makes sense. So we will get an additional position out of this. We will integrate this with our own data systems. We've already worked with these partners, so it's not necessarily a huge lift on our part to be able to take this on to ensure that we have some continuity.
Understood, and because we're taking, it sounds like we're taking over the administration of a part of this from the state, and we're going to be using a part of the money to pay for that administration.
Absolutely.
Okay, got it. Makes sense. Thank you.
Councilwoman Rossetti, any questions? No? Director, I have a couple questions. So in terms of collaboration around these other counties, that just threw me off. Okay, in terms of collaboration across other counties, how does that work in terms of bringing everyone together with the Health and Human Service Department? I know you stated that, you know, this is essentially changing the admin role, but that can be a big role in and of itself sometimes in terms of bringing everyone together and assuring continuity of services. So they're like monthly meetings or something with the Health and Human Service people, or it's just you're taking over the grants? How does the regional collaboration work?
So a lot of the work that has to happen through Ryan White is statutorily required. So the legislation at the federal level requires certain things have to happen. One of the things that has to happen is a planning council. The planning council has to be composed of individuals from the area that is being covered. So in our case, it's individuals from Middlesex, Towland, and Hartford counties. And so we have that. The planning council has to be composed of consumers. So these are individuals who are living with HIV or living with AIDS are a part of the planning council, as well as providers. So we are regularly meeting that planning council. It is ministered by Amplify, which is our used to be what we call the Regional Mental Health Board. That's their new name. And so Amplify hosts the planning council, and we fund them to do that work. So that happens on a regular basis, and that's statutorily required by the Ryan White legislation. Through that process, they work together and direct us and instruct us, basically my team of 2 individuals and a consultant that we have, 2 consultants that we have through Amplify contractors, because Amplify is our contractor, with what kind of services and how they want to see that money split up during the upcoming year. So you recently approved the resolution to apply for and accept, I believe it's $3.1 million for our Ryan White program. When I say ours, the direct funding that we received. How that grant was written, it just went in last week, but how that grant was framed, how we were thinking about the services and how we were splitting up the money Was it psychosocial services? Was it medical services? Was it transportation? Was it housing? The Planning Council, with members with members that represent Tallinn, Middlesex, and Hartford counties, are helping us frame that because they're required to, and we're required to work with them. So that collaboration happens because we're statutorily required to do it, and there's a process for how it happens. So it flows, it works. We work together very well with them. If there's issues, you know, we have to work it out. We're required to have this council, and it allows us to understand the needs of the community in a much more intimate way than probably any of the rest of our programs.
Just one quick follow-up question. In terms of the fiduciary piece, and there is some work involved, do we charge a percentage for fiduciary fees?
It depends on the grants. It will depend on the grant. For this grant, no. Our admin fee is to cover staffing.
Okay, so basically, it's the admin fees to cover the staffing, so it's kind of like that. All right, thank you for that. So I'll entertain any other questions from Councilman Gale or Councilman Rossetti? All right, seeing and hearing none, I'll take a motion to pass item 2.7 favorably.
So moved.
So move. Second, any second, Councilman Gale? All right, I'll second. I think there may be some technical issues going on. So with that being said, motion has been made and properly seconded. All in favor say aye.
Aye.
Aye. Any opposed? Aye. Okay, I heard an aye. Seeing none, item number 2.7 is approved favorably. Thank you, Director Arroyo. I think that's it, right?
That's it.
That's it. Okay.
Thank you, Director.
Thank you, Director, for taking time out of your day and your evening to inform us of all these wonderful grants we're getting to improve the lives of our families in Hartford. So
Thank you. Have a great night.
have a good night. All right. So item 2.8 is supposed to be a presentation by Director Karen Taylor. She was unable to make it this evening. So with that being said, we'll table this one, and I'll take a motion to adjourn. All right. I won't take a motion.
So moved. I don't know. I thought John usually likes to do it, but I think something happened with his
Yeah, it's
audio.
a technical. Yeah, he
Right.
just
So
let me know.
moved. Okay.
All right. So with that being said, everyone have a wonderful evening and enjoy your Monday evening.
Thank you.
All right. Bye.
Good night.
Good night.
Good night.